Cardiopulmonary resuscitation, or CPR, is a life-saving technique that can significantly improve the chances of survival for someone experiencing cardiac arrest. However, incorrect administration of CPR can be ineffective or even harmful. Understanding common mistakes and misconceptions about CPR is crucial for anyone who might need to perform this critical procedure. This video outlines the pitfalls to avoid when giving CPR, ensuring that help rendered is beneficial and not detrimental. One of the common mistakes in performing CPR is not checking the scene for safety. Before starting CPR, always ensure the scene is safe for both you and the victim. Ignoring potential hazards like traffic, electrical risks, or environmental dangers can result in additional injuries or complications. Never rush into a situation without assessing the safety of the environment first. Another critical error is the failure to confirm cardiac arrest. One of the first steps is to determine if the person is actually in cardiac arrest. Skipping this step and starting CPR on someone who is breathing normally and has a pulse can cause unnecessary harm. Always check for responsiveness and normal breathing. If the person is breathing or shows signs of life, CPR is not needed. Incorrect hand placement during CPR is another common mistake. Placing your hands too high or too low on the chest can render chest compressions ineffective. Proper hand placement is crucial for effective compressions. Your hands should be placed on the lower half of the breastbone, not on the ribs or the upper chest. Additionally, insufficient compression depth can also reduce the effectiveness of CPR. It's essential to compress the chest at least 2 inches deep to ensure that blood is being circulated properly. Chest compressions that are too shallow will not adequately circulate blood. It's crucial to compress the chest at least 2 inches deep in adults. Insufficient depth results in poor blood flow, failing to deliver necessary oxygen to vital organs. Inconsistent compression rate. The ideal rate for chest compressions is between 100 to 120 compressions per minute. Compressions that are too slow or too fast can be ineffective. Maintaining a consistent rhythm is essential for maximizing the chances of successful resuscitation. Not allowing full chest recoil. Failing to allow the chest to fully recoil between compressions can reduce the effectiveness of CPR. Full recoil is necessary to let the heart refill with blood. Leaning on the chest or not letting it rise completely diminishes the efficiency of compressions. When delivering rescue breaths, it's crucial not to blow too forcefully or too quickly. Doing so can cause complications like gastric inflation, which might lead to vomiting and aspiration. Each breath should last about 1 second, just enough to make the chest visibly rise. Remember, blowing too hard or too fast can also reduce the efficacy of CPR. While an automated external defibrillator, or AED, is crucial for someone in cardiac arrest, it's important not to delay chest compressions to fetch or set up the AED. Start CPR immediately and use the AED as soon as it is ready. But remember, do not stop compressions for an extended period while setting it up. Misconceptions about CPR are quite common. One major misconception is that CPR will always save the person's life. While it can significantly increase survival rates, CPR is not always successful. It's crucial to set realistic expectations. CPR essentially buys time for professional medical responders to arrive and take over. Another misconception is that only trained professionals should perform CPR. While professional training is highly beneficial, CPR performed by bystanders can also save lives. Often the fear of doing something wrong prevents people from taking action. It's important for bystanders to perform CPR to the best of their ability, as doing something is definitely better than doing nothing. Another point to consider is the necessity of mouth-to-mouth resuscitation. Hands-only CPR, which involves continuous chest compressions without rescue breaths, is recommended for untrained bystanders and is effective for adult victims of sudden cardiac arrest. However, in some cases, such as drowning or pediatric cardiac arrest, rescue breaths are still important. Nevertheless, hands-only CPR is a viable option in many situations. A critical aspect of CPR is the importance of persistence. Some may stop CPR too soon, especially if they believe it is not working. However, CPR should be continued until professional help arrives, an AED becomes available, or the person shows obvious signs of life. Stopping prematurely drastically reduces the chances of survival. In conclusion, knowing how not to give CPR is as important as knowing how to perform it correctly. Avoiding common mistakes and understanding misconceptions can greatly enhance the effectiveness of your efforts during an emergency. Proper CPR technique involves ensuring scene safety, confirming cardiac arrest, maintaining correct hand placement, depth and rate of compressions, allowing full chest recoil, providing appropriate rescue breaths, and utilizing an AED correctly. By adhering to these principles and avoiding common pitfalls, you can maximize the chances of saving a life.